Americans, do you want universal healthcare? Why not? I had a pretty well-paid job making sure the health system I worked for got reimbursed by health plans. 100,000% support universal healthcare. I have an arsenal of stories on how truly fucked up the healthcare system here is, but here's one that has stuck with me. Reviewing a high-dollar chemotherapy claim that was unpaid with my team. Ask them to pull the EOB explanation of benefits that essentially outlines how the health plan paid what they did, or why they didn't pay. The health plan had marked the entire amount, over K, as patient responsibility, meaning they were telling us to bill the patient for it. I personally called my counterpart at the health plan, because it seemed like a mistake. Nope. Turned out the patient exhausted their benefits, meaning they essentially ran out of coverage per the terms of their health insurance policy. This was a PPO plan the patient had through work. In other words, this patient, who is now fighting for their life, and still in the middle of a cancer battle, is going to get saddled with a six-figure medical bill, despite doing everything right by getting good coverage through a good job. Quite frankly, if the cancer didn't kill them, the stress of figuring out how to pay that would have. This same health plan had an insanely ritzy office, and so many perks for their executives it was beyond belief, yet held non-profit status. Made me sick to my stomach. I left healthcare. Edit to add. As someone who has seen the inner workings of the financial side of healthcare in the US, I can say with 100% confidence that there is no good reason someone shouldn't support universal healthcare unless you own a ludicrous amount of health plan stock, or at the executive level of a health plan. Please bear in mind that many countries that have universal healthcare still have private options, so you aren't entirely without choice. My current job is slowly driving me insane, but I can't leave because my health insurance is through them, and I can't take half the jobs I want because they either don't have it or have strings attached. If we had universal healthcare, I could take far greater economic risks without having to worry about potentially being saddled with life-altering debt from a clumsy misstep. Yes. Because cancer is a bitch. I had good insurance, and it still fucked me over. I'll spend the rest of my life trying to pay this off, and chances are, I never will. I'm not even 30 yet. I had a staph infection on one of my toes. I ignored it. I ignored it until my foot was almost the size of a football, American, and half my foot was black. I couldn't afford to take time off, so I kept working when it started. I worked the night I finally asked a friend to take me to the emergency room. The only reason I decided to go was because I got extremely drunk, like 3/4 of a 1.5-liter bottle of Sailor Jerry's drunk. I was worried about the dollar. Anyways, I got x-rayed, stuck in the magnet tube, and had a bunch of tests ran. My main doc told me that I had to choose between half of my foot, or half of my leg getting amputated. I chose half foot. When I woke up, I still had my foot. Something about the infection not getting into my bone. Doc also mentioned that there was evidence of maggots when he abraded the corrupted flesh off of me. I was in the hospital after that for a week. My bill was almost 200k USD. I don't want to change providers every time I change jobs. I also don't want to prop up an insurance industry worth billions of dollars. So, yeah. I'm sitting in my house with a torn something in my knee, probably still bleeding based on the spreading bruise, waiting 2 weeks for some lackey to decide that I'm worthy of an MRI, because I can't talk to an ortho without an MRI, because rules. Also I can pay for the ER visit, MRI and probably most of the PT out of my own pocket, which will set me back years financially. Yay, I want health insurance I can go use when I actually need, and not worry about it ruining me. Give me all of that goodness. Edit. I should add that I have insurance. I have a kid, and my deductible is like $6,000. So I may as well not have insurance. Yes! Exclamation. I have worked in healthcare for 25 years, and I can't afford to go to a doctor! Exclamation. They act like it's some huge favor for the insurance companies to pay for yearly, preventative care, but God forbid they find anything on us. Deductibles are so high that you'll go broke trying to pay for addition testing and treatment. My daughter had a fever abroad in France. We debated frantically if we should take her to the doctor because we didn't know how our insurance would cover it. We thought the worst, and that it was COVID. The doctor did a full exam for €30. We were expecting a huge bill after. Nothing ever came. Yeah, the healthcare system in the USA is utter corporatized filth. Burn it to the ground. I got stabbed 10 times standing up for a woman. I was charged over $10,000 for the ambulance ride, surgery, and additional medical. It was worth every penny. But I was left in debt before my adult life started. Americans, you're already paying for healthcare, you're just not getting it. Your money is going elsewhere. Human resources rep here, and I say absolutely. Every month I have to give benefits meetings, and help employees coming from other companies or unemployment make decisions on insurance as well as those moving on to go somewhere else, and help them all make potentially life-changing decisions on insurance, which they really don't even understand the basics. PPO VHMO. FSA VHSA. Deductible, coinsurance, copay, out-of-pocket max. The glazed eyes I see. It reminds me of how my college allowed credit card companies to sign up 18-year-old kids who knew nothing about finances or credit back in the 90s/early 2000s. Yes. I want my relationship with my work to just be about money. My job and health insurance should not be intertwined at all. I have MS. My healthcare was so much I stopped working and had to let my income fall below poverty line so I could get Medicaid, otherwise I would have died. My monthly medical expenses was twice my salary. Either way I am broke. At least this way I don't have medical debt. So yes! Exclamation. Absolutely. And I would happily pay more taxes to make it happen. Everyone deserves the opportunity of early diagnosis. Everyone deserves medication to heal. Everyone deserves a quality life. I didn't get glasses until I was 26 because I was afraid of the cost. I still have my wisdom teeth that flare up sometimes and cause pain. I want to contribute so people aren't financially ruined for being in an accident. Last year my mom went into the hospital for COVID. This was very early 2020 when we still didn't really know how to treat it, and while in there they found out 2 of her vertebrae had been destroyed by an infection in her spine, so she had to be treated for COVID and have an emergency spinal surgery. She spent 103 days in various hospitals and rehabilitation centers, and the total cost for all of it was approximately $500,000. She's on Social Security because she's disabled, so thankfully she had state insurance. But if the state didn't offer insurance, using only the money she would theoretically get from Social Security every month, which is about dollars, it would take her about 52 years to pay it off, making her 104 years old before it could be paid off. So yes, I do want universal healthcare. As a person who works for one of the evil healthcare businesses, I support it with my whole being. Health insurance is a fucking scam. Dear God, yes. Just let my taxes take care of it, and cut out the blood-sucking health insurance middleman. They add nothing to our society. They have allowed the American healthcare system to explode the price of services and medications, because the consumer doesn't pay the real price as long as they have insurance. In turn, insurance premiums have exploded. Everyone involved makes billions off of the sick people who need care, and prioritize any way they can avoid actually providing that care or insuring it. I'm already paying for my insurance, so just use that money. Plus, employers who cover it wouldn't need to pay those premiums, and could pay workers more. I really challenge anyone to tell me why I shouldn't want one.